Hi, my name is Amanda Harris. Student ID is 2965277, and this is my AVMA video for Pathology 2. First, we will be performing a routine maintenance cleaning on our Catalyst 1 machine. We will start on the home screen, select Instruments, the Catalyst 1, Maintenance. It's not really wanting to read me because of the gloves, and Clean. So I've got my gloves, my alcohol prep pad, and my optical tissue. From here it kind of tells us step by step, and when we've completed each step we select next. So first we'll need to open the door here, pull up on this, remove the incubator ring, take our alcohol prep pad, and it instructs over here what to wipe down. We'll need to wipe down the inside ring of where the incubator ring was sitting, and then we will need to clean the reference tile, which is the white one. Kind of tight space here. Cleaning the reference slide here. Then we will place the ring back inside. Kind of grooves into place. Then we will close the top, shut the door, select next. We've placed the carousel back in and done. And as you can hear, the machine kind of does the rest. It calibrates that we've cleaned it. Canine heartworm test on our ELISA machine. So I've got the Snap 4DX, our blood drawn and placed into a purple top, our conjugate, and our tube. So we'll select the patient, which is Kiesel, select Run, our Snap Pro, all right. We've got our pipette, which we'll use to take 3 drops of whole blood and place into our mixing tube. And then we will place 4 drops of the conjugate into the same tube. Invert the tube a couple times so that it's mixed well. Place the mixture of conjugate and blood into our snap test. Once the mixture of blood is in the snap test, you can see it's starting to come down. We will request the test on here and then insert into the machine. Incubation time is about 7 minutes, and the time has started to count down. Right, so our canine heartworm test is finished, and it did come back negative. The machine is still processing that, and it will pop up with the results. If it were positive, our machine also lets us know by beeping. Alright, today we will be performing a modified knots test. We perform this test to check for heartworm disease in canines or felines. Alright, we've collected our sample and placed it in a lavender top tube. We will take 1 ml of the blood collected in our lavender top tube and 9 ml of 2% formalin and place them in our centrifuge tube. Here we have our 1 to 9 mixture. We're going to invert and mix the solution, and then we will centrifuge it. To get our 2% formalin, we mixed 2 ml of the 37% formaldehyde with 98 ml of water. And now we're going to centrifuge this for 5 minutes at 1500 RPMs. Alright, so we've centrifuged our mixture of blood from the lavender top tube and the 2% formalin. We're going to discard the supernatant from the top, and then we will mix methylene blue with the sediment at the bottom and view it under a microscope. Alright, so we're adding the drop of methylene blue. We're going to mix using the pipette. And then take a drop of this and place it on a microscope. Slide. Place our cover slip on top and view it under the microscope. Alright, we're going to examine our findings under the microscope for our modified knots now. Alright. And it is positive for microflaria. Alright, and that's how you do a modified knots. Alright, next I'll be demonstrating 4 different ways to run a fecal test. The first being fecal flotation. We do use a commercial fecal solution, so we do not need to mix it in a cup and strain it first. I've got a vial here for us to mix some feces in with the fecusol, or fecal that the owner brought in. We'll take about 2 to 5 grams of fecal matter and place in that vial. We'll then fill the vial about 3/4, and mix the feces up with the fecusol. Removing any grass or large lumps. Then we'll fill the rest of the vial up until we get our meniscus at the top. Then we'll place cover slip on that meniscus. And set our timer for 15 minutes. Alright, our timer has gone off, so we'll take our cover slip and place it onto a glass slide so that we can view it on the microscope. At 100x magnification. We want to make sure that we're lifting straight off and right onto the cover slip onto the microscope slide. Alright, here's our microscope. We're at 100 magnification there. We can go to the 40 or 400 magnification when looking for specific parasites, such as coccidia, that are much smaller. Alright, our fecal is actually positive for whipworms. Performing a direct fecal smear. Alright, we'll take our glass microscope slide, apply equal parts of the fecusol with the feces onto the slide. Making sure that it is clear enough for us to look under on the microscope. No thick lumps of feces that we won't be able to see through. All right. We will now apply a cover slip to the slide. And observe it under a microscope. Adjusting with our coarse knob first. viewing on the 100X. This is the same fecal that was from our previous dog Marina, who was positive for the whipworms. Now we'll be demonstrating how we would run a fecal with the centrifugation. We'll be running it much like a urine sediment or urinalysis on the centrifuge due to not having a swinging bucket centrifuge. Alright, so we've got our materials here. We've got our gauze sponge, a sample cup, the tubes that we'll use in the centrifuge, and our Fecasol. So firstly we'll mix 2 grams approximately of our feces material. Add our Fecasol and mix thoroughly. Then we will strain our mixture through a gauze sponge into our tube to be centrifuged. And this is to avoid any large clumps. We'll apply the cap and we'll centrifuge it for 5 minutes. Alright, our fecal centrifuge has finished with its 5 minutes. We're going to fill the rest of the way up with our Fecasol. Apply a cover slip to the meniscus. Alright, we're going to fill the rest of the way of the tube for the centrifuge fecal so that we develop a meniscus. We will then apply a cover slip to the top of it. We'll allow this to sit for 10 to 15 minutes undisturbed, and then we'll place the cover slip onto a microscope slide and examine it under the microscope. Alright, we've allowed our fecal to sit for 15 minutes. We will take the cover slip and apply it to a microscope slide. Again. We did observe this fecal through a simple fecal flotation earlier, and it came back positive, which is why I'm using it for my sedimentation and centrifuge fecal videos so that I know whether I've done it right or incorrect. It was positive for hookworms. That's how you do a fecal through centrifugation. Alright, next we're going to be showing how to run a fecal with sedimentation. We've got our dry gauze, our cup to mix the sample with, and our tube that the sample will eventually go into. So, to start, we will need 2 grams of our sample of feces. We'll add in our tap water. And mix the sample. Making sure to break up any large clumps. We'll take our dry gauze and our tube, our centrifuge tube. And we're going to strain our mixture into the tube to be centrifuged. We're going to allow this to sit undisturbed for 30 minutes. Alright, so as you can see, we've got our sediment here at the bottom of our tube. We're going to remove all the water fecal mixture till we get down to the sediment. Without disturbing it. And we will collect a small amount of sediment. Alright, we're looking at our fecal through sedimentation under the microscope at the 40 power. That's how you do a fecal through sedimentation. Canine's ear for an ear cytology. We'll actually be using my dog. We went out to the lake and he's been shaking his head since we went out there. So, I've got 2 swabs, one for the right, one for the left. I've broken one of the Q-tips so that I know which one is the left ear and which one is the right ear. Sit. Making sure that we get a good sample from the ear canal itself without going too deep to hurt the eardrum. Apply them onto a microscope slide, being sure to roll the sample and not smudge it. Got the right ear on the top. And then the left ear on the bottom. Then we'll briefly heat fix it. Clean off the bottom of the slide. Apply it directly into our first jar, which is the fixative, for 15 seconds. Alright, we're going to transfer our slide to the second jar, which is a stain. Alright, we're going to transfer our slide to the second jar, which is the stain is eosinophilic red stain. And it will be in that one for 15 seconds as well. Alright, so we're going to be placing our ear cytology in the last stain, which is basophilic blue stain or purple stain. It will be in that one for 15 seconds as well, and then we'll wash it with distilled water and view it under the microscope on oil immersion 100 magnification. Okay, now that this slide has been in the basophilic stain for 15 seconds, we're going to rinse it off with distilled water, not applying it directly to our material on the slide. We don't want too much pressure to hit the cytology itself. We're going to allow this to air dry, and then we'll look at it under the microscope. Alright, we have our ear cytology now. We're going to be looking at it under the microscope. On the high power, which allows us to apply oil to the microscope slide. We have our immersion oil. We're going to place just a drop onto the slide. So when I zoomed in, I used our coarse focus knob. And now that I am zoomed in appropriately, I'll just use the fine focus knob. Which is the small one here. And then, like I said, I'm just going across. Then up, then back to the left. Alright, today we're going to be showing how to collect a sample for fungal testing. We're going to be using the hemostat technique, which is where we'll pluck 10 to 20 hairs from the site of a lesion. The other technique is a toothbrush technique, where we'll use a clean toothbrush and brush against the hair follicle about 20 to 30 times. That is typically used for cases where there are no lesions present. Alright, we're going to use the hemostats to pluck 10 to 20 hairs. And we're going to place those hairs in the medium. Being sure that we don't bury them. And just place them right in it without completely submerging them. Dermatech is the brand that we use for the fungal testing from Henry Schein. The reason we would run any type of dermatological fungal testing would be animals that have lesions present, pustules or papules that are present, cases such as ringworm where we want to confirm that further than just using a woods lamp, which is not always 100% accurate, and animals that have history of alopecia. Alright, we're going to be performing a skin scraping today. We've got our microscope slides, our tin blade, and our mineral oil. We're going to apply the mineral oil to the microscope slide. Take our tin blade, dip that in the mineral oil, and we're going to start scraping. That's good. Looking for a part of the hair that is showing the most alopecia. And start scraping against the hair follicle until we start to see it bleed. Alright, that's what it looks like afterwards. And we've taken the scalpel blade and put it in the mineral oil, and we'll look at it under the microscope. Alright, we're going to be looking at our skin scraping on the microscope. On 4 power.
Hey, Jackie. I forgot. Leave the stuff here, right? Yeah, I'll go grab them.
Skin scrapings are typically done on dogs, preferably or typically young puppies who are presented with symptoms of mange, hair loss, irritated skin. The depth of the scraping is just dependent on which mite that we are looking for. Mange, you would need to scrape a couple layers beneath the superficial skin to draw a small amount of blood. Mites such as lice live on the superficial layer of the skin, so you just need to scrape the first few layers. Today we will be performing a necropsy on a canine, 6-month-old puppy. We will need gloves, a gown, and our mask.
This is Dr. Joe Worster, and we are performing a necropsy on an approximately 6-month-old male cadaver dog. So I'm about to make a midline incision, and we will do our abdominal exploratory and get some biopsies for, or some sections and biopsies for practice. Making a midline incision. Expected. We're seeing omentum covering the abdominal viscera here, jejunum. Follow that kind of here to duodenum, and there's pancreas. Follow it right up here to the pylorus, where we can see both limbs of the pancreas. We'll go ahead and get our biopsy of the liver lobe. There's the gallbladder right there, which is normal. So if we were doing send it off histopathology, we could just get this piece of liver here. And we can go ahead and we'll put that in formalin and label it as such. We're not going to go into any viscera if we don't have to, since we've got a lot of post-mortem autolysis, and that would be something that would clear the room potentially. So we can go over here and visualize some. There's the spleen with appropriate omentum around it. Down here is the left kidney. You might be able to see that. See, normal. A lot of times, for instance, if we are worried about a post-mortem, so we get a dead dog that comes in that we feel like has died of renal failure, we'll take those out and allow someone to evaluate them for ethylene glycol toxicity. So I'll go ahead and get that one out if I can. And you wouldn't necessarily need to send in the entire kidney, but we can go ahead and get that in formalin. Let's go small. So you would want to evaluate the right kidney as well, which is right down there. Go down. Urinary bladder, if we can find it. There it is. It's actually got some urine in it. A lot of times you could take urine from that as well. So that's the extent of the abdominal portion of the necropsy. I assume we need to do a thoracic portion as well. We can evaluate just sort of the pretty well into the heart here, or into the chest rather, heart, surrounding lungs, and they're obviously deflated because of the post-mortem changes. So a lot of, in a small dog like this one, you're going to have a lot of thymus. That's all thymus in the cranial mediastinum right there. There is vena cava. So, you know, if you're looking at a pathology, you could certainly take the heart out and weigh it and make sure that it meets parameters. You could look at chambers as well to see if chambers are enlarged or if there's any kind of congenital abnormality like a patent ductus arteriosus. So that would be the extent of it. If you wanted to, you could get a piece of the lung just as we've done the others with just sort of a sampling technique with just a scissor, but everything there is kind of as expected. So that's the extent of our necropsy.
Alright, so we have our samples from the necropsy. We've taken a kidney, labeled, and a piece of the liver, labeled. I'll now be discussing how we take and approach an animal that is suspected for rabies. If the animal needs to be euthanized and not quarantined, the head must be submitted. You must wear a gown, protective eyewear, an appropriate mask, and gloves. The removal of the head should only be done by professional personnel such as a veterinarian or technician, preferably one that's been vaccinated against rabies. The head must then be placed in the refrigerator and not the freezer, and when shipped to the appropriate destination, it should be packed with ice packs. It should be double bagged and then placed in a styrofoam container, which is then placed in a cardboard box. The remainder of the body can be necropsied if the animal did bite somebody or the owner has requested a necropsy, and then it can be disposed of through appropriate means such as cremation. This of course pertains to the state of Texas, and each state could have a different protocol to follow when rabies handling is required.
I'm going to do a vaginal cytology on this female that's in heat. First we're going to do a chlorhexidine scrub of the external genitalia, followed by an alcohol scrub, kind of alternating in between those two. Get off any bacteria that we could introduce into the lower reproductive tract, although there's already going to be some bacteria probably in that particular part of the anatomy. Okay, and now I'm going to use a sterile cotton swab. And we will put a little saline on there to moisten it. And then we're going to make sure that we get back behind, going back, I guess, caudally to avoid the clitoral fossa, and then up forward. Trying to get some epithelial cells to exfoliate. All right, there we have that, and we can make our slide.
Alright, now we will take the vaginal cytology swab and roll it onto our microscope slides. Being sure not to smudge it. Alright, now we will stain our vaginal cytology. First in the fixative, dipping it 5 to 10 times. Then into our red stain, which is the eosinophil stain. Again, 5 to 10 times. And last into our basophil stain, 5 to 10 times as well. We'll then rinse this with the distilled water, allow it to air dry, and look at it under the microscope. We will now be viewing our vaginal cytology on the microscope at a 400 power. Zooming in with our coarse knob. And then fine focus. There's definitely bacteria in here. We've got red blood cells in here, obviously. Nuclei are still present in our epithelial cells. Not seeing any angular cells yet. So I believe our dog is in decided that the patient that we performed a vaginal cytology on is in proestrus. explaining the 4 stages of estrus, the first being anestrus, where the patient has no signs of vulvar swelling. On the microscope slide, we would typically see non-cornified squamous epithelial cells. The second stage would be proestrus, where the patient has vulvar swelling and reddish discharge. On a microscope slide, we would typically see high number of erythrocytes, basal and parabasal epithelial cells. The third stage of estrus would be estrus, where the patient has a swollen vulva with pinkish discharge. On the microscope slide, we would typically see all squamous cells, cornified and non-cornified, and nuclear. The fourth stage would be metaestrus, where the patient's vulvar swelling would start to decrease. We would not see discharge from the patient, and we know that there would be a history of previous estrus cycles. On the microscope slide, we would now see that the cornified epithelial cells have changed back to the non-cornified epithelial cells. Those are the 4 stages of estrus. We will be performing a cross-matching procedure today. I've collected our blood in an EDTA and a red top tube. We're going to let the red top tubes sit for 30 minutes to clot while we spin the purple top tubes down. Spun down the recipient and the donor's lavender EDTA tubes. We have our plasma here. We will pipette that plasma and discard it. Making sure that we don't disturb the clotted red blood cells at the bottom. There we have our packed red blood cells. Alright, next we will be taking 1 to 2 drops of the packed red blood cells and placing them in our centrifuge tubes and filling the rest of the tubes all the way with 9% saline solution. Alright, we will gently mix the packed red blood cells and saline solution, and then we will centrifuge it for 1 minute at 3,400 rooms per minute. Alright, here we have our red tops that have been centrifuged, and we can see our serum here. We're going to pipette that serum out of the tubes and place them in new red top tubes with no additives. Here's both the recipient and donor's serums. Here is our first erythrocyte wash. We're going to do this 2 more times. So we've got our last erythrocyte wash done. We're going to remove the saline solution from the top And this is what we'll use for the remainder of our cross match. So now we're going to take 0.02 mils of the packed erythrocyte and add it into 0.98 mils of sodium chloride solution. Here I've got some centrifuge tubes that we'll be using, one the donor, one the recipient. I've got 2 drops of each donor and recipient, 2 drops of serum. And we're going to place 2 drops of the erythrocyte wash to these. We're also going to make 2 controls, each with 2 drops of the recipient's serum and the recipient's erythrocytes, and the donor serum and the donor's erythrocytes. Then we're going to spin it down. Alright, so here we have our controls, where the recipient's serum and the recipient's erythrocyte wash have been mixed together, and the donor's serum and the donor's erythrocytes were mixed together. We have our major and our minor. We're going to allow these to incubate for 30 minutes before we centrifuge. Alright, so we've got our test tubes after they've incubated for 30 minutes at room temperature. We're now going to spin them down at 3,400 RPMs for 1 minute. I don't see any apparent agulation or hemolysis so far. Now we're going to take a drop from our major and a drop from our minor and place them on a microscope slide and cover them with a cover slip. Alright, here we've got our microscope and our microscope slides. We're going to examine this under the microscope at low power. Alright, I am seeing some incompatibility here, if I'm reading this correctly. Some agulation perhaps. Which we could kind of tell based on physical appearance, some hemolysis was present. And that's how we perform a cross match.